So, Kristen, how do we help organizations prepare for digital transformation?
We've been a healthcare system that has relied on stakeholders for so long in a system-centric approach. But we really need to shift the mindset towards consumers and families and care partners and the people that we really need to center digital transformation around, because ideally they're going to be the ones that are receiving that care. So in order to prepare, there's a whole set of skill sets that are arguably missing from the development cycles inside of healthcare today that we need to fill, such as behavioral neuroscience and digital techniques that are designed to engage people the way that they engage with their mobile devices and smartphones in every other area of the economy. You know, we can get on our phones and we can order meals and transportation, and we can make an appointment for almost and a reservation for anything we want in our lives except healthcare. So they're now thinking differently about how to change, and they're thinking about consumer satisfaction, right? We have all waited in a, provider waiting room way too long. And now we're seeing systems say, well, if somebody's been sitting in the waiting room for, more than 7 minutes without being seen, I'd love to pop up on their mobile device a coupon for a free cup of coffee at the cafeteria. And maybe we should install some art so they can wander around, in a calm setting before their medical appointment, and just let them know when to return to their visit. So
Yeah,
they are thinking differently, and it's exciting.
Yeah, I know. It's making me think of the spa-like environment and how to sort of combine the two. What role does education play? And maybe let's chat about pre-COVID and post-COVID, because we know that, so much of this digital transformation was accelerated during the pandemic.
Absolutely. I would say pre-pandemic, digital transformation and the education that was happening around digital transformation was centered still around how do we take the experience of consumers going into a largely system-centric environment and digitize those experiences. Well, you can take a really poorly designed workflow and put it in an application, and it will still not be used, right? Post-pandemic, what we realized is that we have to meet people where they are. Meeting people where they are means that if I, as an individual, Kristen is one person. If I prefer convenience, meaning I'll see any doctor if I need care that day, over loyalty, which is I need to see my doctor, and everybody's preferences are different, or I'm okay to text message a physician or to get on a video call, or I prefer a voice call that's not video. We need to meet them where they are and also make their comfort level so that we can still get care. We know through post-pandemic, telemedicine has seen, a shining moment, which I think will continue. But at the same time, what we're lacking is people going in for preventative cancer screenings. So we need to think about how do we encourage people to still get those screenings. You don't necessarily have to have a colonoscopy in an ambulatory care center. You can actually do an FDA-approved toilet water test at home. So we need to think about what consumers are comfortable with and their preferences, and then deliver the care in the way that they're willing to receive it.
Okay, so we need to create custom experiences for patients, but we also need to create custom experiences for our clients in the healthcare space, because they probably don't really know what they need since the industry is moving so fast. So just going back to skills and education and openness to learning, what are you noticing in terms of, that piece?
What I'm excited about is, we're dealing with health systems across the country, and they're thinking out of the box around how to actually, for the first time in a long time, change their workflows. Keep in mind that health systems have largely been reliant on patient portals for their consumer experience, but we still operate in a sick care system. We wait for people to be sick or to come into, to us as healthcare institutions, and then we treat them. We need to do the reverse, right? We need to be able to bring people in when there's something that they need on the preventative side, in addition to when they're sick. So, when we think about workflows and transformation, the systems are realizing that they don't just need to treat patients who are already existing. They can actually take their skill sets and go out to the broader community through digital and be there for them with appropriate fact-based education and information, because quite frankly, consumers trust doctors more than anyone else in the healthcare ecosystem.
Do you think that it's the doctors that we need to be educating? Because in my experience, and I'm in Canada, doctors, and I know this is how it is in most Western countries and even the developing world, doctors just don't have time. And so is the education happening to doctors, or is it happening to to other stakeholders that are then passing those policies or rules down to the practitioners?
Yeah, so digital transformation is actually, it's not about technology. It's actually because consumers and family members and care partners and doctors are quite frankly dissatisfied with the status quo. So doctors do need support. The average doctor visit is 17 minutes. So when a consumer comes in and they have a sinus infection or an acute issue, the doctor needs to focus on that acute issue. But at the same time, there are open gaps in care around things like missed mammographies or colonoscopies, or maybe someone needs to be screened for obstructive sleep apneas. There's not enough time in that encounter to hit everything. So doctors do want help and support. They want consumers to have the information that's necessary, have the education they don't have time to give, and then be able to treat when they do come in. I think technology can be a barrier or it can be an enabler. And when we think about things like, wearables and devices and all of the massive amount of new data in the market, we can't just push that to a physician and expect them to interpret it. There needs to be a layer of intelligence that sits on top. So physicians are actually very willing and open to helping people or to helping their patients in a new digital way. But we need to be smart about the technology that exists and how we use it so that we become an enabler and we don't become a burden.
Yeah, really, really well said. And to be smart about that technology, that's really, really important. What do you see as challenges ahead then for digital transformation?
Yeah, I mean, the biggest challenge is that we effectively have to take our entire healthcare delivery system and flip it on its head, right? So we have been driven on a system-centric model that is designed for sick care and fee-for-service. If we're going to really move to value-based care, population health, preventative services, and we become person-centric, then our entire model has to change. And we have to change it in a way that we don't go bankrupt in the process, right? And that involves a combination of regulatory changes, reimbursement changes, technology changes, and quite frankly, just the way that we do business. But it's here, it's now, and I would say post-pandemic, it's essential. And there is a speed at which the industry is now moving that I've never seen in my 20-year career in healthcare.
In the US, we know that there are just so many systems. So how do they all start to communicate? How do they all work together? We could have, all these different stakeholders conversing and collaborating, but at the end of the day, how do these different types of technology and software communicate and from a sort of a portability perspective? And I'm also just wondering where you think we need to get to from a technology angle. With Bowhead, we're really big into patient data ownership, de-identified data sharing, security, immutability, decentralized storage. So yeah, curious what you think in terms of technology.
Yeah, and in the US market, right before the pandemic hit, we passed two really monumental bills, something called information blocking and interoperability rules. And these are rules that effectively empower the HIPAA patient right of access. So anyone who is data blocking will be fined, up to $1 million fine per instance reported if they're not sharing that data. That we're now in a technology era where open API infrastructures can securely be used to help empower consumers and to help move that data. Consumers now can gain access to get their medical records digitally. And that is huge because we believe that data needs to be stored and centralized with the person it matters most to, the individual. And it needs to be portable from that individual to securely and in an informed fashion share data with whom they feel can provide value in their healthcare journey. Data can come in, we can surface an insight, we can deliver it to consumer exactly at the time that they need it. And that needs to happen in a digital format because we are outside the doctor's office 99% of the time. The Karen Alliance is a private-public partnership that is comprised of healthcare industry stakeholders, technology companies, and consumer third-party applications, with representation and support from the government as well. And it's a collaborative group that has said, we're going to get together, and instead of, each independently creating how we're going to comply with various new rules and regulations like information blocking, we're going to centralize on standards that we can all use together. So it becomes something that is very powerful because the industry can get behind it. We can write implementation guides. We can help bring along, the smaller facilities and payers in addition to the bigger ones who might have more capacity or money for technology. So a lot of people are trying to catch up on payer data and EMR data, but we're already working on things, and actually just passed is something called real-time pharmacy benefit check, where consumers in a participatory fashion can, at the point of care, say, oh, you want to prescribe me this drug? I can type it in, and all of a sudden from a PBM, I can see, is there a prior authorization? Is there another drug that's in the same class for the same reason that is more affordable
Wow.
to me? And then we can take great companies like GoodRx and others behind the scenes and integrate them and say, well, should I use my healthcare benefit or should I use cash? And what's the cheapest pharmacy for me to fill that script? So being able to really move towards consumerism, where consumers today largely don't know that if you fill your drug at different pharmacies, it could cost you something different.
Yeah. Wow. That's huge. That's amazing to hear that. What more do we need to do to get patients really demanding this kind of transformation?
Yeah, well, one is that we need to do a little bit better job at educating consumers about their rights. Most people don't follow the regulatory, frameworks, and when you say HIPAA, eyes glaze over, and so we need to do a much better job at simplifying the rights of a consumer and a care partner. I think the demand is actually naturally already there because people are so frustrated with how they have to make appointments and fill out forms and pick things up on CD and show up in person. And, so we're naturally seeing the pull, and that's evidenced through net promoter scores and other satisfaction metrics with healthcare overall, right?
Yeah.
When you ask about timing, the good news is there's already people doing pieces of this, and we're doing it across the world. But right now, we still have only about 20% of companies on the cloud. We need to get that to about 80%, and we need to do it in the next 5 years. Because when you move to the cloud, then all of the data becomes a little bit easier to move, and it's easier for someone to take risk, i.e. move into a capitated model, when they can see the whole picture. Because today, and I live in Baltimore, so I sit within a stone's throw of Johns Hopkins and MedStar and University of Maryland Medical System and Mercy and all the private practices. So those systems don't communicate with one another. And so in order for us to get to where we need to go with consumers, the data has to travel with the consumer. People have got to get on the cloud and get to an open API infrastructure. And then consumers have to say, I want my doctor to see all of my healthcare data when they treat me, because then the doctor can say, well, I can see all of Kristen. I can see how she's, operating at home. I can see, all of the clinical conditions, all the doctors that she sees, all the medications that she takes. And I feel comfortable saying, I've got Kristen's back, and I'm going to go ahead and handle that. So Theta Care is an organization out of Wisconsin, a health system that has already rebranded themselves a population health company. And some of their big initiatives are on things like social determinants. How do we not just focus on the health of the individual from a clinical perspective? How do we help the whole person? And how do we forge the relationships within our own community to make sure we can get those people help?
Wow. That's really exciting. So this idea of kind of whole body, whole person medicine, lifestyle medicine is really kind of merging now with within the healthcare world. The intersection of what we have in the big data world and healthcare with integrative and functional medicine is really going to transform healthcare. Thank you so much for tuning in and learning with us. It's clear Kristen knows a thing or two about digital transformation. What really excites me is the move from a healthcare system focused on sick care to prevention and helping people when they're still healthy. Big Questions is intended to help us all envision a better healthcare system for the digital age. If you like what you see, please follow along our journey.